Hi everyone, this is a patient who got 4 fillings done with a different provider. She developed symptoms after the appointment, mainly to flossing and slightly to biting. After having the discussion, patient and I decided to redo her fillings in the hopes of getting rid of her symptoms. So it was 1,4 DO, 1,5 MOD, and 1,6 MOL. Because there was no 1,6 distal and 1,7 mesial that were worked on, patient didn't have any flossing sensitivity there. So I decided to leave the 1,7 OL component and only remove the 1,4 DO, 1,5 MOD, and 1,6 MOL. So this is the part where I'm removing the existing fillings and evaluating the tooth structure underneath. I'll be fast forwarding through the drilling part, but the main takeaway is I tried to go slow so that I don't remove excess tooth structure beyond where the existing fillings were. Here I am ensuring that I'm removing all composite in the box component, so DOMO part, but still making sure I'm not unnecessarily overextending the prep. The textural difference between the composite and dentin allows me to know when I've removed enough of the composite and slightly into the fresh dentin. I find that composite has a very shiny texture, visual texture, whereas dentin has more of a rougher visual texture. There is a slight difference between composite and dentin in terms of tactile sensation as well, so I'm also relying on that. Some people prefer using diamond burr 557, but I personally feel like I can tell the difference better if I use carbide, and it has to be a fresh carbide for me to be able to tell the difference in density, so to speak, between composite and dentin. A way to ensure that I have smooth lines for my preps is to make sure I have a good steady fulcrum, and I often use ring finger on a tooth right behind or two teeth behind if I have the luxury of the space. I'm bringing the scaler down to the gingival margin, ensuring that there is no flash of either composite or enamel. The last thinnest layer of composite can be difficult to see or feel. This will catch that extra bit and I'm able to flick it off so that I'm making sure that I am fully on dentin. Here I'm turning the microscope light off temporarily so that we can take a photo of the preps that I've done for the teeth. So for the actual filling part, I decided to use the Toffelmeier matrix system for 1/5 first, and then 1/4 and 1/6 together with sectional matrices. Although this takes a bit more time than using sectional for all, I find that this gives me the most predictable outcome in terms of shaping and the convexity that I like for interproximal areas. And what I do with Toffelmeier matrix is I fill that one tooth, take off the matrix, polish the area so that the adjacent fillings can also be shaped properly up against the filling that I just finished. Once the tooth is properly isolated, I cleanse the tooth with hydrogen peroxide and chlorhexidine, rinse that with water, and then bring in etch and bond. Here I'm applying desensitizer and air drying before bond application. In the past, I didn't use desensitizer and the wetness of the dentin was so finicky that there were times where I would get post-op sensitivity unpredictably. Since then, I've been using desensitizer for all filling appointments and I rarely get sensitivity issues afterwards. For the interproximal box component, I like placing a thin layer of flowable. Here I'm checking the depth of the prep to see. The composite I'm using is bulk fill, so technically 4 millimeters and shallower I can bulk fill, but I don't trust it entirely. That's why here I'm not filling the box completely. I'm only half filling it obliquely to the palatal component, and because that flowable component is very thin, when I insert the bulk fill composite, it extrudes out the side, which lets me know that the composite went all the way to the bottom of the prep and there is no gap. I am using my Explorer to shape the marginal ridge component, and here we're curing. I'm repeating the process for the buccal component of the mesial box. A little bit of flowable at the bottom and then inserting the bulk composite on top. This instrument I called mine. I only use 2 instruments for my filling appointments. There are dentists out there who carves out beautiful anatomy using 10 different instruments, spends way much more time than me. But I find that this gives me some anatomy that is practical, where patients don't find the fillings sharp to their tongue, floss isn't catching, and there is enough central groove that allows proper fitting of the teeth. This video is sped up, but I do spend quite a bit of time with the Explorer shaping the marginal ridge component. This will allow patients to have an easier time flossing and ensures that there is tight contact, nothing getting in the way of their tongue, food not getting stuck in between underneath, and overall just a filling that feels nicer to the patient. Here I'm repeating the process for the distal box component. Same thing, working on the palatal component first, carrying that, and then adding the buccal component afterwards. So here I'm trying to do the same thing for the distal box, but the shape was slightly too small for me to predictably deliver the composite straight from the gun. So after placing a small amount of flowable at the bottom of the prep, I carried the composite manually into the prep and placed it with my instrument and the Explorer. For the buccal component of the distal prep, I felt comfortable placing it directly from the gun. So you see me angling it in a way where I can visualize the composite getting extruded from the tip, and then using my instrument, this is the other end of it, to shape the marginal ridge component. And I'll also be using the Explorer to shape the marginal ridge area. I'm really taking the time to get rid of the extra composite so that I don't have to spend as much time polishing or shaping with burrs. It's important to check the filling from different angles, because seeing things from bird's eye view can give you only one-dimensional answer. I'm turning my mirror around so that I can evaluate my marginal ridge height as well as the anatomy. After removing the top of my matrix, I am curing one more time interproximally to ensure there is no uncured composite. Even though I did things in layers, I'm making sure by curing once more. And because this is a standalone filling that I've done, I like bringing metal interproximal strips so that the shape isn't too bulky. Essentially, if the shape is too bulky, that'll take away the space needed for the adjacent teeth. So I'm taking the time to polishing manually with the strip. Sometimes I bring on carbide burr. This is, I call a Christmas tree burr. I'm shaping the interproximal area to get rid of any flashes, making sure the anatomy is convex but not too rounded so that we get a nice contact area. Once I'm happy with the anatomy of the 1-5, I go ahead and place the sectional matrices for 1-4 and 1-6 adjacent preps. Here I'm using the Garrison matrix system. I'm making sure once the rings go on that the seals are tight and the contact area looks nice and adapted. I wasn't completely happy with one of the contact areas, so I readjusted the sectional and the ring, and I'm shaping it to make sure it's adapted properly. Because every tooth is different, one system cannot be perfect for everyone's anatomy, so in these extra spaces where the ring isn't perfectly adapting, I fill the gaps with Teflon so that I prevent extra composite material from extruding out, which will require me to spend time polishing afterwards. Once everything's sealed to my liking, I cleanse and etch bond the teeth like I did before. turning my mirror around constantly to ensure that my anatomy is to my liking. Here, I felt that the marginal ridge was slightly deficient up against the 1.5 distal marginal ridge. So I added a little bit. I'm using a flat instrument to round off the edge and using the Explorer to getting rid of any extra flash of composite. I'm doing the same thing for the 1.4 distal component. I often find first premolar anatomy quite challenging to work on because the embrasure space is quite big. So I do spend quite a bit of time using the Explorer, getting rid of the extra material, especially on the palatal side of first premolars, so that I spend less time polishing afterwards. Shaping the OL component of 1.6. The prep was too wide for me to fill in one increment, so I'm working on the occlusal part of it and curing. Here I'm shaping the gingival portion of the lingual part of OL prep. I'm ensuring that there isn't too much material, especially where the lingual prep turns into the occlusal. That part people commonly overfill, which require adjustment afterwards. Now that everything's filled, I am checking one more time, and once I'm happy, I decide to remove all the sectional matrices and the wedges and cure one more time for final cure. Again, using my Christmas tree carbide burr to shape the interproximal area, getting rid of any flash of composite material or bond that escaped the sectional matrices and the Teflon isolation that I've placed. This is a different carbide burr. It's a short Christmas tree. It has a pointier tip and the burr length is shorter than the regular Christmas tree. I like using this for the actual marginal ridge component if I want to round it off a bit or polish. Because the tip is so pointy, I'm able to bring it right in between and not open up the contact area while still polishing the ridge component. I'm going over everything with the carbide football, and once I remove the rubber dam, I adjusted the bite one more time with polishing cups and making sure the bite is not too high. Thanks for watching, everyone.